It's 6 letters, one word. It's free to say, won't cost you a cent, but crisis is not a word you'll hear Andrew Little say. That's despite GPs, surgeons, nurses, aged care workers, midwives, all urging him to do so. Here's aged care nurse manager Natalie Seymour.
He needs to recognise that nursing is in a crisis and the aged care sector is suffering.
General Surgeon Frank Frizzell on surgery and cancer surgery delays.
I've never seen a time like at present. It's the worst it's ever been.
Here's Andrew Little. Minister, welcome to the show.
Good morning.
I'm sort of on your side in some ways. I don't want to get too caught up in the is it a crisis, isn't a crisis. But clearly there are a great number of people within the profession, healthcare, who want you to just acknowledge it, to just say that it is. Will you do that this morning?
Look, we can use all sorts of labels. The reality is we have a health system that is under major pressure, has major challenges. And those people, including the people who you've just had those quotes from, they're on the front line, they're seeing it every day. They are really feeling the pressure, as everybody is in the system. In the less than 2 years I've been Minister, I've been told of multiple crises in the system. The term is debased in health at the moment. What's most important is that I and this government recognises the serious pressure and problems that the health system has. We've done that. That's why in the 5 years we've been in government, we've added 5,500 clinically qualified people to our health system.
Okay.
That's why we've increased funding to the extent that we have, $13 billion extra over the next 4 years in this year's budget. It's why we have a $7 billion building program across our hospital network. Compare that to the $1 billion in the previous 9 years.
Minister,
we take seriously the problems in the health system.
And yet we find ourselves in this situation still. So I guess the next question is, what is a crisis? When would you use the term? What would it take?
Again, we can talk all about sort of definitions. What we have is a system at the moment and a set of circumstances where we have, on the 2 years into COVID, the worst winter we are experiencing in the health system.
Yeah. How many nurses short would we need to be?
Massive increase in flu infection.
We're 4,000 nurses short. How many would it need to be before you'd call it a crisis?
Well, we've had chronic shortages of nurses for some time, but then part of the shortage of the nurses is because we've increased the funding for the number of nurses that we have. We haven't filled all the gaps. The work to recruit to fill those nursing gaps is well underway. We've now opened the borders. We can now get nurses across the border without any impediment. That work is well underway. We've had those shortages. It's because of those shortages, as I say, in the last 5 years, that this government has put the extra funding in to fill those gaps and get the extra people on board.
The thing about it is, your argument is that, you've got to be careful with your language and, people throw the word crisis around all the time, right? I guess the issue that those on the front line have is that it's a word that you've used many times before. When you were in opposition and National was in government, you said there was a homelessness crisis.
I'm not quite sure where that gets this discussion for the health system.
You also said there was a housing crisis.
So those frontline health workers who I meet when I get out to hospitals, they tell me the experiences they're having.
Yeah, Minister, if I could just finish. You said there was a housing crisis. Yeah. You also said there was a mental health system in crisis. You also said that children's mental health was in crisis. So it was okay to use the word then. What's changed now, other than the fact you're in power?
I can explain the mental health crisis because there was a rapid increase in the number of people reporting mental health issues, and a government at the time that did absolutely nothing about it. Had not added anything to it, had not even undertaken to examine the extent and nature of the problem. We've done that, and we've made a big investment, and we've added over 900 people to the front line in terms of mental health services. We've got another $100 million in this year's budget that we've put into acute mental health services. We have addressed that issue. When it comes to the broader health system and the challenges in the hospitals at the moment, we've added 5,500 doctors and nurses over the last 5 years. We've put in billions of extra dollars every year into the system to address the gaps and the issues that are there and the shortcomings that are there. There are still challenges. There are still problems.
Let's talk about
a health
those.
System.
Yeah, let's talk about those challenges.
The reason we changed the health system is because we had a system that was simply incapable of managing the chronic problems in the system.
Absolutely.
That's why we changed the structure. We now have a system that's better placed to address that.
Okay, let's talk about some of the possible solutions here. And if you listen to the Nurses Union and others, there are things that they want to happen that you could action. So I want to get a sense of how motivated we are here. Have you gone to or written to the Minister of Immigration and asked him to put nurses on that fast-track list for residency? Because it would help your sector.
I've been part of the discussions. The Cabinet has made its decisions. I got a message from a Kiwi in Manila over the weekend who's working with a whole bunch of nurses over there saying they are more than eager to come to New Zealand, and the 2-year work to residency is simply not an issue.
So based on one individual, you're going to keep that policy setting, despite the thousands of nurses that are represented by the Nurses Union saying otherwise, based on one person in Manila?
Yeah, I think the people who are most affected by it are the people who are overseas at the moment and who are making choices about whether they want to come here.
Minister,
and
this is why aren't you fighting for the sector? Why aren't you fighting for them?
That says that it's not an issue, and that's probably better than people sitting in Wellington, sort of, opining about, what may or may not be the case.
You're talking about the Nurses Union.
Yep.
Seems a bit disparaging.
I can talk about the nurses organisation because they also claim about the need for more nurse pay. Nurses in New Zealand in hospitals right now would be on base incomes between $10,000 and $12,000 a year more had the nurses organisation not blocked the pay equity deal that they signed up to in December last year. You can understand that I find the nurses organisation, talking with a forked tongue on many issues.
Do you think you've got a healthy relationship with workers' unions at the moment?
Yeah, very good relationship. Dealing with the home care and support workers because they are trying to get their pay equity deal up. They've been blocked for 5 years from getting pay equity. I'm working very closely with the unions involved there and indeed with the providers to get that process underway. We've got some funding in place now so they can get on with their pay equity deal. We need to lift pay and conditions in the health sector, particularly for those on the lowest levels of pay.
Okay.
That's what we're focused on doing. We're focused on getting nurse pay improved. We work with the nurses organisation. That's what they asked me to do this time last year. We did that. We made a deal. They've walked out on the deal. They're now litigating it. I can give no certainty to nurses about when we can lift their pay, that extra $10,000 to $12,000 a year more that the pay equity deal actually identified was needed.
One final issue, and this is an issue that we get contacted about a lot here on the program, and one that Christopher Lux has now waded into this morning. Have you asked for advice, or have you asked Aisha Verrill to lift the mandates on health workers so that we can have, by their estimates, the 500 to 700 nurses and healthcare workers who are currently not working in New Zealand because of the mandates, the vaccine mandates, back into work?
I know that Dr. Verrill has those things under constant review, so she is responsible for that, except to say that those mandates were put in place for the safety of both staff and patients, and at a time when COVID infections are rising and the number of COVID cases going to hospital are rising quite rapidly now, we still have to make sure that everything we can do to keep people safe and keep infection prevention and control appropriately managed in hospitals is very important.
All right. Minister, thank you very much for your time this morning. Appreciate it, as always.